This session will be on data entry using WHONET and be presented by Dr. John Stelling. And just to say a brief words on that, this collaborating center network exists since 2016 and consists of 21 WHO collaborating centers with a mission to assist WHO in supporting countries to build capacity to develop and implement national AMR surveillance and glass. We're on the second session now using WHONET, and we'll have 4 more sessions coming up, which we will send out invitations for very soon. So over to you, John.
Hello, everybody. Good morning from Boston. It's 5 a.m. here. As you can see, we have a full agenda, and so I'll go, just get started. We're going to focus on a short introduction to the WHONET software, the work that we've been doing in Boston as a collaborating center. Also, just as a reminder, please keep yourselves on mute so that it doesn't interfere with the presentation. Most of the presentation will be focused on the topic of getting data into WHONET. So WHONET is a simple microbiology laboratory database software. So step 1 is to get the data into WHONET. We will install the software. We'll see how to configure the laboratory so that you can get started. What is your country? What are your antibiotics? What are your methods, disk diffusion, MIC, etc. Then we will go through data entry. So that's for manually typing data into WHONET. And many laboratories in low-resource countries utilize that, and people doing research projects and others will use manual data entry to WHONET. We will also talk about the backlink software. Many of you already have a computer system. It might be something simple in Excel, or it might be a machine like a Vitek or a Microscan, or it might be a laboratory information system, commercial or locally developed. So then we will talk about the backlink software, how to download data from your system into WHONET. So these are the 2 basic ways to get data into WHONET: manual entry or by downloading data that you already have. We will spend a little bit of time on getting data out of WHONET. I'll just mention the concept of data analysis. That's not the focus of this presentation. And as you saw, there was a separate presentation on that later in this webinar series. Because it's simple and quick and easy and important, I will also do a demonstration on how to export data from WHONET into glass. So a little background. WHONET is a software for surveillance of microbial populations and antimicrobial resistance. The reason I mention it's not only for antimicrobial resistance is that it really is about following resistant and sensitive strains, primarily bacteria, but people also use the software for fungi, parasites, viruses, clinical reporting. So it's really about looking in a broad way at changing microbial populations locally and internationally, and with a special focus, of course, on their antimicrobial resistance characteristics. I'm based at the Brigham and Women's Hospital in Boston. It's one of the Harvard teaching hospitals, WHO Collaborating Center. So Dr. O'Brien, who has been my mentor, I started in 1989, so 30 years ago, practically. And he had this vision that clinical microbiology labs around the world generate routine data every day that could and should be utilized to provide a detailed view of evolving microbial populations in real time. Unfortunately, this wonderful resource remains largely untapped and underutilized. So his idea back in the 1960s, he trained under Kirby and Bauer and Charis. His idea back in the 1960s using mainframe computers was to use a common software to support local, national, regional, and global collaboration and analyses to support a number of objectives. These would include recognition, tracking, and containment of emerging threats, cost-effective care and treatment guidelines, public health policy, interventions, advocacy, and research. And one of the most important is laboratory capacity building. Sometimes we find laboratories where the data have difficulties. I recommend collecting those data. If you don't believe the data, do not publish them. Do not put them in your annual reports. Do not report them to WHO if you don't believe them. But if you capture the data, this can be a valuable part of a strategy to improve laboratory capacity through feedback and auditing. So we developed WHONET with 2 objectives in mind: improve the use of local data for local purposes. Secondly, to promote national and international collaborations through the use of a common software with common tools. Between these 2 objectives, the more important one is the local data for local purposes. Because if you find the software useful for you, for your pharmacy, infection control, researchers, policy, then the software will continue to be used into the future. If there is some value to you, your colleagues, and to your patients, then you will have the ability to contain resistance and develop your policies and evaluate your interventions at the local level. Of course, if this is successful locally, then of course we highly recommend participating in the national, regional, and international collaborations such as WHO GLASS. The data come from the microbiology laboratory in human, animal, food, and environmental sectors. But many people utilize the data, not only microbiologists. Pharmacists, infection control, infectious disease specialists, general clinicians, IT staff, epidemiologists, and researchers can all benefit from utilizing a microbiology laboratory management software. This is an old slide from 2013 indicating registrations of WHONET around the world at that time. We currently estimate about 130 countries utilize WHONET and perhaps around 3,000 laboratories, mostly hospital laboratories, also public health, food, and veterinary laboratories. In January will be the 30 years anniversary of the creation of the WHONET name and the WHONET software. I continued Dr. Bryan's work from previously, so we're going to repeat the survey in the new year. So we'll talk about two softwares on the webinar today. First of all, WHONET. As I mentioned, we'll talk about how to install WHONET onto your computer, how to configure WHONET for use in your laboratory, data entry, data analysis, data and result sharing, including data export to GLASS. So we'll focus in this presentation on WHONET manual data entry, as well as backlink. If you already have a computer system, such as text, Excel, Vitek, etc., we don't want you typing the data into your system every morning and then retyping those same data into WHONET in the afternoon. We want some automated, electronic way to export the data to WHONET once a day, once a week, once a month, once a year, whenever you would like to analyze and share your data. So the focus of this presentation is data entry and backlink to get the data into WHONET. So this is the WHONET web page, the WHONET homepage, and from here you can install the software. There are three softwares that you will see here. The one that we will talk about on this webinar today is the WHONET 2018 software. It is a desktop software, meaning it runs on your computer and on your local computers. It is not a web version of WHONET. It's simply a local desktop software with data entry and analysis and configuration. So that's the focus of today's presentation. We also have a web version of WHONET. For data entry, it's working quite well, but it still needs a fair bit of work on the data analysis module. So there is a demo on the website that you can go through yourself. I may show it today, but on the earlier webinar earlier this week, there was not enough time to demonstrate that. But go to the website and you can go through the demonstration on your own. WHONET 5.6 is basically the old version. WHONET 2018 and WHONET 5.6 are practically identical. They look the same features, the same analyses, the same underlying data files. The main difference is that WHONET 5.6, I wrote myself using an old computer language that Microsoft no longer sells, and we've now replaced it with WHONET 2018. Basically, it's the same software. You will see it to be the same. But it's written in a nice modern language, which permits more features and automation and security and emails. But if you already know WHONET 5.6, you will have zero trouble learning WHONET 2018. The only visible difference is that WHONET 5.6 goes into the WHONET 5 folder by default, and WHONET 2018 goes into the WHONET folder. You can have both softwares installed on your computer at the same time without conflict. So today I will only continue talking about WHONET 2018. I'm now going to go to the website. I'm going to go to whonet.org. Here you see the three softwares I mentioned. You see, focus only on the left, downloading WHONET 2018. There, you can do an online installation and an offline installation. The two versions of WHONET are identical. It doesn't matter if you choose the first one or the second one. WHONET will be the same software. The only difference is not WHONET, it's the installation package. If you want to install WHONET on a computer that's connected to the internet, such as the computer that I'm using right now, I can download the online installation. The only advantage of that is it's smaller and faster because it's connected to the internet. It doesn't have to download everything. On the other hand, if you have a computer in your laboratory that is not connected to the internet, then you should download the offline version of WHONET onto a computer with the internet, and then using a memory stick or some other way, copy the file over to the computer without internet and do the same installation. So in short, these two softwares are identical. The only difference is that if your computer is on the internet now, use the first one to do the download, and if not, then use the second one. If you have any trouble with the online installation, switch to the offline installation. If you have any trouble with the offline installation, talk to your IT department. It's very common in hospitals and other facilities that normal laboratory staff are not allowed to install softwares. The IT department does not want viruses and incompatibilities. They want to review softwares. So if you have any trouble with installation, first discuss it with your IT staff. If they have questions, then of course contact us here in Boston. If I click on download, the software immediately starts downloading, as you can see down here. And I'm just going to cancel it because the software I already have installed. And I'm exiting out of that. I'm going back to my PowerPoint. Excuse me. Great. So WHONET has three areas. The fun, interesting part is data analysis. The tedious, boring part is data entry. But before you get started with any of those things, first you need to configure the laboratory. You need to tell WHONET what country you're in. We have a special country that we use for demonstration purposes called WHO. But I'm in the United States, so I can put United States, etc. You give your laboratory a name. You give your laboratory a three-letter code. You tell WHONET whether you are predominantly a human laboratory for human isolates, hospital, or public health. It doesn't mean you do human only. Also in a hospital laboratory, it's normal to do occasional sinks and environmental and food samples, but a hospital or a human public health lab would be predominantly human, so you choose the first choice. But if you are predominantly, or if you do a lot of food and environmental or animal testing, then choose the second option. The software is identical. It's just that if you choose food, animal, human, WHONET will give you more lists, more possibilities for data entry. Then there are four questions here on the lower left-hand side. Only the first one is required. Tell WHONET what antibiotics you want to analyze. Tell WHONET if you're using CLSI, UCAS, DISC, MIC test. You can define what WHONET called panels. These are my gram-positive drugs. These are my Pseudomonas drugs. These are my Salmonella drugs. So that's antibiotic list and antibiotic panels. That's followed by locations. If I work in a hospital, a location might be 5 South Medicine inpatient, or diabetes clinic medicine outpatient. Or if you work in an animal setting, the location might be the name of the farm, or the name of the market, or the name of the zoo, the name of the veterinary clinic. Or if you're working with food, it might be the name of the market, the name of the restaurant. So WHONET is very flexible with regards to where the samples come from. The next option is called data fields. A data field is a question. For example, what is the patient's name? What is the patient's date of birth? What is the organism? What is the beta-lactamase result? WHONET automatically offers you a standard list. First name, last name, specimen date, specimen type, etc. But you can add more questions to that list if you would like, and you can remove questions that you don't need. For example, if you work in a veterinary laboratory, you don't need the animal's first and last name. You don't need the animal's date of birth. So you can have a long list of fields with name of physician and diagnosis in response to therapy, or you might want to have a very short list to match the information available to you. Most people do not change that, but of course you can change it if you would like. And finally, alerts. WHONET has a list of 190 alerts. These include high priority, well, there are alerts such as important species, important resistance, and quality control. There's high priority alerts such as Neisseria meningitidis is important. Salmonella typhi, these are high priority alerts. MRSA, VRE, ESBL are medium priority alerts. And Klebsiella pneumonia sensitive to ampicillin is a low priority alert, which is more quality control and educational in manner. So you define the country, human, animal, and the antibiotics. If you would like, you can also modify those other options. To draw a distinction between a normal standard WHONET configuration and a minimal glass configuration, they mostly ask for the same things. Patient ID, patient name, age and date of birth, sex, date of admission, patient type. By patient type, I mean adult, pediatric, or newborn. Location, ward or clinic, department, location type, specimen date, specimen number, specimen date, number type, organism, and antibiotic results. So in a standard WHONET configuration, it asks you all of those things. And if you do that, you can do GLASS. If you want to do the minimal, GLASS does not ask for the patient name. GLASS does not ask for the ward or clinic. GLASS does not ask for the department. GLASS does not ask which hospital it is. So if you are using WHONET for your own local purposes of infection control, local pharmacy, you probably want the standard list, which is more complete. But if your focus is purely reporting to GLASS, then the second one will ask fewer questions. Very flexible, so you can add and delete questions over time as you would like. WHONET generally asks all of the antibiotics you test, all DISC, MIC-E test, whereas GLASS is asking very specific things. For Staph aureus, they want to know the oxacillin or the sulfoxetine. So there's some differences between a normal, complete configuration versus a more minimalistic approach. This is what the data entry program looks like on the WHONET desktop version. At the top, I put the patient details, or animal, or food, or environmental. For this presentation, I'm talking about patients because that's the predominant focus of most, well, right now of GLASS, but also most WHONET users. Name, first name, last name, date of admission. If you have that, very valuable, if you can get that. Followed by location information, which ward, which clinic, medicine, surgery, inpatient, outpatient. Specimen date, type, and number. Organism questions such as organism and serotype. And then the antibiotics, such as DISC MIC-E test. And here you see a fairly broad list of a lot of antibiotics that this laboratory tests. After you enter those details, just like in any web-based, in any software for data entry, there's also comments and diagnosis and other things you may want to put at the bottom. After you complete data entry, you save the isolate, and then you proceed with the next isolate, either from the same specimen or from a different specimen, from the same patient or a different patient. And you continue saving the data until you've finished your data entry for the day. Here under View Database, you can retrieve and see everything that you've entered so far in the database. You want to make edits, you want to delete, you simply want to retrieve a patient results. If you have a physician calling and asking for results, you can go to View Database and pull up the results for that patient. You can also print clinical reports. WHONET's strong point is not doing day-to-day clinical reports. WHONET's strong point is more data analysis, data sharing, but also many laboratories do use WHONET to report back to their clinicians the results. This is what data entry looks like in the web version of WHONET. So as you can see, it basically is the same logic and the same general ideas. The desktop version, it looks different because it's a web application. I chose a GLASS demonstration to illustrate it's a much shorter list. There's no first name, there's no last name, there's no location. So this is what it would look like on the web version. In data analysis, just go through this one slide. I can say what type of analysis I want: graphs, charts, outbreak detection, alerts. I can choose which organisms: bacteria, fungi, parasite, viruses, or things such as no growth, contaminated specimen, normal flora, and which data files you would like. And with those three questions, you can begin the analysis. Or before beginning the analysis, you can say specimen type equals urine if you want a subset. Or you might say one per patient. So if I have a patient with 10 isolates of Staph aureus, I recommend putting all 10 isolates into WHONET. So for certain things, I want to see all 10. Maybe the patient started with sensitive and maybe the isolate mutated to resistance. Maybe the patient has multiple distinct strains. Maybe the patient moved from location A, B, C. So if the patient has 10 Staph aureus, I want all 10 Staph aureus in the database. But when I'm doing my annual statistics, I do one per patient. I don't want the patients with multiple isolates to bias the result. So WHONET is very flexible and permits you to remove repeat isolates in a number of ways. So that's all about getting data into WHONET and a little bit about data analysis. On this presentation, I will also demonstrate using the WHONET software as a live demonstration, how you can export data from WHONET to GLASS. So what you're looking at here is a screen grab from the WHONET software. Under the data entry screen, you see it says combine or export data files. So I can combine many files together I can take many small WHONET files and combine them into a large WHONET file if you would like. or I can also export it to GLASS. So here I've chosen GLASS. And once you've exported to GLASS, GLASS requests, if possible, two files. The RIS antibiotic statistics, I'll call that the numerator, how percent resistance, how many R, how many I, how many S for the different priority drug-bug combinations within the GLASS protocol. There's also sample statistics. For example, that would be how many bloods, how many urines. So if your database includes only the antibiotic results, but without the negatives, you can make an RIS numerator file. But if your database does include the no-gross and the negatives and the Pseudomonas and the Shigella, and the Providencia, the other species, if you have the ability to report on how many you did, then you can also prepare the sample statistics, or I'll refer to that as the denominator file. WHONET then offers you, after I click on Combine, offers the option of validating those results before, so you can see, is it the numbers that you expect, or are there obvious mistakes, or are there questionable results that you want to investigate? And then after you do that, then you can upload the data to the GLASS platform. And there are other opportunities for learning how to work and upload data to the GLASS platform. So that's the end of the first portion of the presentation using PowerPoint. And I'm going to go and do a WHONET live demo. Just take a quick look at the time. Okay. So here I'm now entering WHONET. Well, what can I do here? I see many laboratories. When we start WHONET, when you download WHONET, WHONET gives you 3 laboratories. I have some other things. I'm going to delete these. Delete laboratory. Delete laboratory. So for my demo the other day, delete and delete. So when you install WHONET, you'll see these 3 laboratories. The WHO Test Hospital is the one that we use for teaching purposes. We give you 1 month of sample data to play around with it. We have these nice tutorials where you can actually teach yourself the software. Everything I'm doing on the presentation today, you can also do yourself afterwards using the tutorials, and I will show you where the tutorials are. This one here called GLASS is almost the same. We're going to combine those two together. The only difference is that these are old human data without age, gender, and date of admission, and it follows our tutorials. This other one, we don't have tutorials highlighting the analytical capabilities, but this file does have age, gender, and date of admission, so it makes a more interesting example for teaching GLASS, but we're going to merge those two together. We don't need 2 different human examples. And the first one, AGISAR, is the WHO's advisory group on integrated surveillance of antimicrobial resistance. This particular example includes 300 human, animal, and food isolates. So when I'm working with food and animal and Salmonella public health labs, I use the AGISAR data set as a more interesting, more relevant example for them. Okay, great. So I'm going to go to the first time you start, I can click, if you're starting with data entry from the very beginning, I can click on New Laboratory. The country, I'm in the United States. Laboratory, my hospital is the Brigham and Women's Hospital. And the laboratory code is BWH. For demonstration purposes, I'm going to call this human, animal, food, environment. And then I have those 4 questions that I mentioned. Most people do change the first 2, antibiotics and locations. Most people, data fields and alerts are very important, but most people do not change them. You can change them, but most people are fine, like to leave them the way they are. But I'll come back and have a few more comments on that in a little bit. I'm going to go first to antibiotics. Here on the left, you see the list of all the antibiotics that WHONET knows about. Ciprofloxacin, penicillin, etc. So, on the right, you see the list of antibiotics for your laboratory. In this particular example, my laboratory has no antibiotics yet because I said new laboratory. So I have the choice at the top of choosing CLSI or UCAST. I have DISC-MICE tests, and I have my antibiotics. So my first example, I will choose amikacin CLSI DISC. I use this arrow key in the middle, or double click, to select the antibiotic. AMK means amikacin. D30 means disc diffusion, 30 micrograms. N used to mean NCCLS, but the new name of NCCLS is CLSI. So the antibiotic code tells you exactly what test was requested. I'm going to I'm going to search. I'm typing in Cipro, if I can type it correctly. Cipro, disc, select. Cipro, MIC select. I can do that. Or I can come down again and I can type penicillin, penicillin G, E-test select. So each laboratory can make their own list of the antibiotics and test methods that they would like to do. Once I've made that list, I can do move up, I can do move down to put it in the list that's most convenient for me. Breakpoints, WHONET knows the breakpoints. You don't have to worry about that. If I go to breakpoints, diffusion, WHONET shows me the diffusion breakpoints. I go to species-specific MIC, and you see all of the different special breakpoints for staph and enterococcus and Kingella and Neisseria. So if you are an expert, maybe you will want to edit and change those, but most people, WHONET knows the official breakpoints. So it's nice that you know they're there, but you don't have to go in and modify them. WHONET does have this feature called Update Breakpoints. So once a year, you can download the new version of WHONET, install the new version of WHONET, come to the screen, and then update the breakpoints to incorporate the new set of the new breakpoints. Click OK. To facilitate data entry, there's the section I mentioned to you earlier called panels. I'm going to go to panels, and I see those 4 antibiotic tests that I just indicated. And amikacin for Staph aureus, yes, it's possible. You can do that. Cipro, yes. Disc and PT. So in fact, Staph aureus, all of these are somewhat reasonable. I'm going to do this somewhat randomly. So here, you just go through and you say which antibiotics you test for which organisms. For example, in gram-negative, I would test certain things, but not in others. So let's see. So if I go to OK, that's my panels. Profiles is a similar concept. Panels is basically what antibiotic results do I want to enter. Profiles is for WHONET's multi-resistance analysis, where you put which antibiotics you would like to analyze as your special focus. But that's an analytical feature. I won't talk further about it now. I'll click on OK. So that's how I've defined my antibiotics. And I can come back anytime later and add or remove antibiotics. Now I'm going to click on locations. And this is optional, but it's hugely useful to the local laboratory and the local clinicians, infection control. I'm going to put in those. I'm going to say, for example, neurology might be a patient location. I'll give it the code of neuro in the BWH hospital in the Department of Medicine patient. And then maybe I'll put diabetes clinic, diabetes, Brigham and Women's Hospital, medicine, outpatient. And now I'll put Farmer Brown. In case I do get animal samples, I'll put this Brown. No institution, no department, but that's a farm. Or I could put McDonald's restaurant number 5. I'll put MCD 5, and I'll put here restaurant. Or I can put, for example, what else? I live in the city of Boston, but there's another town close by called Malden. So Malden, I'll just put Malden, and that's just community. It's the name of a community, a town. So it's very flexible with regard to the different location needs of where your samples come from different kinds of laboratories. Now that I've entered my locations, I will click on OK. But before I do that, explaining a little bit more, these 2 columns on the left are very local. They're very specific for you. For example, you might have a code 5 South. I'll call that 5S. And maybe that's Brigham, and maybe that's surgery, and maybe that's inpatient. So 5 South is what you call it, and you want to call it and leave it 5 South. But it's also useful if you simply separate inpatient, outpatient, or medicine surgery. And also at the national level or GLASS level, at the level of your country, they don't really care what 5 South is, but they do care if it's inpatient or outpatient. So that's another thing that you can do here is to help on the left, be very specific for your facility, and on the right, introduce some degree of standardization to facilitate data sharing. Now click on OK. Now I'm going to click on Data Fields. On the left, you see all of the fields that WHONET wants to offer to you. If you're not happy with that list, you can modify the list and add questions like diagnosis or gene type or phage type or gram stain, or you can remove questions if you would like. Because I said food, animal, human, it did give me additional questions at the bottom of this list that are especially oriented towards food and animal issues. You can also make your own list. Here it says code list. If you want to make your own list of different foods or your own list of doctors or your own list of towns, counties or states, you can make your own list using code list. Here under location, WHONET says, oh, location, we would like that to be, WHONET's suggesting 6 characters. But many people actually want 10 or 20. They'll just maybe type in the full name. So it's very flexible for things that WHONET doesn't really care very much about in terms of how long it is. But sex is a 1-character field, or organism, it's a 3-character field. So WHONET introduces standardization when that's important for data sharing. WHONET offers great flexibility for things that you may want to change that are not so important for other people. Here you can see at the bottom, sex is for human and animal, but not for food. Last name is a human question, so that is also customizable for which sector. I'm going to click on OK, and I'm going to click on Save. And now I'm going to go into the data entry program. Before I go into the data entry program, I'm going to show you the help screen. On the help screen, if I go to About, you don't get a lot of help, but you do get my email address. If you have a specific question for me, write to me at my email. Or if you have a general WHONET question, just write to help@whonet.org, because I share that with 2 other people. So if you want a specific response from me, write to me. If you just have general WHONET question, write to help, and you'll probably get an answer more quickly. If I go to help, there's also the first thing under help is documentation. So I'll show you documentation now. It sends me to a folder on your hard drive. And here you see at the top all of the backplane tutorials. But for what I'm talking about right now, the WHONET tutorials, WHONET getting started, including installation, lab configuration, what I just did, data entry, data analysis part 1, data analysis part 2, WHONET's expert system, macros and Excels for automating analyses, if you do the same analysis every week or every month. And then finally, WHONET cluster detection. WHONET has a lot of features for finding automated outbreaks, hospital outbreaks or community outbreaks. There's a tutorial on that. With WHO, we've also made a special one for GLASS, which doesn't go into WHONET's analytical features, but it does go into the installation, the data entry, and the configuration areas. This document called WHONET for GLASS has been translated by WHO into the 6 official languages of WHO. They're available on the WHONET website. Okay, those are the tutorials, and I'm going to close that now to return to the software. And I'll go into data entry. So I have new data file. It's just like Word or Excel. If the file does not exist yet, click on New. If you have a file that you were using last week and you want to continue using the file, then you do Open and then you choose the file that you want. Also, just like in Word and Excel, the files that you were using most recently show up here at the bottom of the screen if you just want to choose a file that you had open yesterday or a few days ago. Under New Data File, WHONET is every file that you've ever worked with has a name and a location. Sometimes people say, John, I lost my data, but it often means that they actually don't know where the data are. So WHONET is suggesting that you put the data in the WHONET data folder. And WHONET is suggesting that you call the file W for WHONET, 2018 for the year, USA for the country, BWH for the laboratory. But these are simply suggestions. WHONET just wants to save you some effort, but you can change it. The name of the file doesn't have to be USA. You know what country you're in. You don't have to retype that. Or I could say blood study, blood study 2017, whatever your laboratory code is, like BWH. So any name is fine. Any valid Windows name is fine. And in terms of location, WHONET data is a perfectly nice, logical place to save your data, but you can put the data anyplace else. And especially if you have a network, if you work in microbiology or infection control, instead of putting WHONET onto one of your local computers, it's more convenient to put the data onto one of the central computers. That way, everybody shares the same WHONET, the same configuration files, the same data files. So if somebody in the lab makes the files or edits the files or updates the files, everybody else in the hospital that you give access to will have also the same updates. So many times it is useful to put the data not on your local hard drive, but on a network drive to facilitate sharing within your organization. Now I'll just accept the default, W2018 in the WHONET data folder. I will click on Save. I created this file a couple of days ago, so I'm just going to overwrite the one I made a few days ago. This is what the data entry screen looks like. First of all, you see the human questions, but if I go to animal, the questions have changed. Food, the questions have changed. So, if I go to animal type, it gives you a list of animals or species. You see cat, dog, chicken, etc. But I'm going to put this back on human. Okay. I'm going to type location, patient ID 12345. My name is Stelling, John, male. I'm not putting my real date of birth. I'm not really 38. I am an adult, more or less. And location here on the right-hand side, you see those locations that we defined in configuration. So if I experience stuff like click on neurology, WHONET already knows what the code is. It's an inpatient, it's medicine. If you have so if I click on diabetes clinic, it's outpatient. If it's an inpatient, we encourage you to try to include the date of admission. For example, I'll put, where we were in October, I'll put October 15th, 2018. If I just put October 15th, WHONET assumes it's this current year. You don't have to type the year. Specimen number, 1, 2, 3, 4, or whatever, 6, 7, 8, 9. Specimen date, I'll put today. So here you can see that this is hospital day 5, 15, 16, 17, 18, 19. So this is useful. The GLASS definition of hospital or community is based on hospital day 3 and later. So if you have the date of admission, we can make that distinction. If you don't have that information, then we simply report to WHO GLASS, it's unknown. Well, if it's outpatient, it's outpatient. But if it's inpatient, we need the date of admission. Okay, specimen type, I will put blood, urine. If you don't know the code, you just do a search. Like if I search for URI, you see many kinds of urine. So the normal simple WHONET codes have the common specimen types are simple codes. Like I'll put mistyped BL for blood. Moving on to organism. You see here on the right-hand side of the screen, the normal basic short list of relatively common bacteria, fungi, and viruses. The GLASS list is the one specific for GLASS, the 8 pathogens that GLASS has requested, as well as no growth. If you want to do full GLASS reporting of the sample denominators, you also need to put in the Pseudomonas and the Providencia and the Serratia, because that's needed not for the numerator antibiotic statistics, WHO is not asking for those, but in terms of how many bloods, you need to put all the bloods in. So you'll just need to make that decision about entering the minimal approach or everything approach. Okay, so let's see. If I don't know a code, for example, E. coli, if I type, for example, myco, it gives me mycobacteria, many mycobacteria, and mycoplasma. Or if I type E space coli, I have Entamoeba coli and Escherichia coli, excuse me. So it helps you to find things. You see at the bottom, the antibiotics. These are my 2 disc antibiotics. This is my 1 MIC antibiotic, and this is my 1 E-test antibiotic. And you should recall, these are the exact same antibiotics I entered earlier under laboratory configuration. So you control that list. I'm now going to put here Staph aureus, or Enterococcus or something. Now that I've done that, it's not giving me the full list. It's only giving me the amikacin. It's not showing me the MIC. It's not showing me the E-test. Whereas if I put Staph aureus, it's showing me everything. That's that feature I mentioned earlier called panels. You tell WHONET which antibiotics go with which organism group. It just makes the life of the data entry person easier. If I'm entering an E. coli, I don't want to see the oxacillin. Okay. And then I type, well, serotype if you're doing salmonella work. And let's see, what else do I want to show here? Okay, and amikacin. I have here amikacin disc. I have the ability, here you see that 15 to 16 is the intermediate range. Anything less than 15 is resistant. Anything larger than 16 is susceptible. So I'm going to type here, for example, 20 millimeters, that's sensitive. 6 millimeters for Cipro, that's resistant. So we do encourage you to put the measurements because it's the correct way to get the correct result for clinical reporting. Breakpoints can change, and if the breakpoints change, you want the measurement so you can compare your old data and your new data. The measurement is also very valuable for evaluating data quality, and also the measurement is valuable for looking at epidemiology. If you have 2 patients in the same room, and one is high-level in terms of high-level versus low-level resistance, The clinician doesn't care. If it's high level, low level, I'm not going to use that drug. But if you have two patients in the same room with Pseudomonas and one is high level gentamicin resistance, one is low level gentamicin resistance, that's probably just a coincidence. But if they both have high level resistance, I'd be worried about a contamination. Patient A infected patient B, or a healthcare worker infected both of them. So the measurements are very valuable for doing this kind of tracking. WHONET does accept R, I, and S. WHONET does not require that you put measurements. If you put measurements, there's more value, but almost everything works with purely the measurement. With purely the interpretation. Down here on the right, you do see alerts like low priority alert. I'm now going to go to organism. I'm going to type Bacillus anthracis. Anthrax is an important finding. That's a high priority alert. So those are the different kinds of alerts that you can see. Now click on save. Save and continue with the same specimen, and I see in red the summary of those alerts. And now I have a blood with a second organism. I can type E. coli with its antibiotic results. I'll now click on save. And okay, there are no alerts for this organism. WHONET, I can also type APCC25922. So WHONET also knows the quality control strains, so you can keep track of those results. I will save that. Save. Now that I've saved all of my data, I can click on View Database. And this is just showing me in a spreadsheet format everything that you entered. You can sort, you can search, you can find, you can delete, you can print out clinical reports or a logbook. You can edit the table if you want to make some changes right here on the table, or edit the isolate if you want to save changes. No. Let's see, and edit. Clicking right, okay. And then you can continue making changes there. So it's just a normal, simple data entry program that people learn quickly. Okay, I'm going to click on, the software does have a feature called caliper. This is for people with a digital caliper that for measuring zone diameters, but that's all I will say about that. Click on exit. Okay, I think that's all I have to say now about data entry. As long as I'm here inside of WHONET, I'm going to, just to show you if I wanted to add more antibiotics, I can go to Modify Laboratory. I can go Modify Laboratory from the main menu, or alternatively, I can do it from the original menu. If I go to WHO Test Hospital, Modify Laboratory, this allows you to add more antibiotics, add more locations, so that modify feature is very useful. Also, I showed you how to do new laboratory, but if you are using the European TESI system or WHONET Argentina or GLASS, there is a shortcut. So for example, GLASS, I'm going to do GLASS, new laboratory. Country, I'll put United States, and I'm going to put, BWH GLASS demo, and I will call this GLASS, GLS. Okay. WHONET's offering you two options. You want a standard WHONET configuration, including name and location. That's the main difference. Or a minimal approach. I'm going to choose the standard definition because most people do want locally the names and the locations. I'll click on OK. And I will say UCAST, and I will say OK. WHONET has made a new configuration. Do you want to review the new configuration? Yes, I do. And here you can see that it's back to the same configuration area. We'll click on antibiotics. And now this list has been filled in with the GLASS antibiotics. So there's no vancomycin, there's no there is cotrimoxazole. There's no vancomycin because that's not on the GLASS list. But every antibiotic on the GLASS list appears here. If I click on panels, you will see for Staph aureus, the only thing they want is oxycillin or cefoxitin. So this indicates the GLASS request. So you may want this, but then for local purposes, you may want to add other antibiotics that you find valuable for local reporting. You also may want to delete things. For example, here we have doripenem, ertapenem, imipenem, and meropenem, whereas most laboratories only test one or two of those. I'll click on cancel. I'll click on OK. And I'll click on cancel. Save the changes no. So that's all I want to say about configuration and data entry. I do want to show you, as long as I'm here, the export to GLASS. To do that, I'm going to go back to Open Laboratory and choose the GLASS demonstration lab. And I'm going to click on Open Laboratory. As I mentioned during the PowerPoint, from here, I can go to Data Entry, Combine or Export Data Files, And here I can choose as many data files as I want. I made that other one on the other day, but I can choose 1 or 50 or 200 files. Okay? So you can choose your whole country, and only one person in the country does this, the national data manager. The participating laboratories do not export to GLASS. The participating laboratories send their WHONET file to the national coordinator, and then the national coordinator does the export to GLASS once a year. Instead of saving this as WHONET, which would simply combine those two files together, I can export this to GLASS. And it's going to make the numerator file and the denominator file. I will click on Combine. It's now doing a series of analyses of blood, urine, genital, and stool, and the 8 pathogens and antibiotics in the GLASS protocol. Oh, and it didn't find anything because the data that I'm showing you are from 2015. I have to put the correct year. Let me redo that, this time with the correct year. So doing all those analyses, creating GLASS files with the correct structure and the correct codes. And after it's finished, it's asked you, do you want to look at the validation form? And I say, yes, I do. So here I can see everything that is going to go to GLASS, but I'm just going to simplify this. I don't want to see all of the pathogens right now. I would like to validate my E. coli. And I want to just validate the blood E. coli. And I see this is a small data file. There were well, actually, let me put urine. There's more urine. There were 143 urines, percent resistance. You're kind of looking, are there mistakes, things that you would like to double check? If you would like, you could do the breakdown by male, female, age, gender, inpatient, outpatient. Copy paste this to Excel using copy table if you want to continue your validation efforts there. Exit. So once you're happy with the validation, then you take these two files, the RAS and the sample files, you go to the GLASS website, and then you upload the data to the GLASS website. Now click on Exit, File, Exit. And now I'm going to continue with backlink. I'm not going to give you a demo of backlink just for lack of time. We ran out of time for sufficient questions on Monday, but I want to make sure that you have an idea of what backlink is for. So backlink, as I mentioned, is for capturing existing data. This is an extremely important software because the majority of labs around the world do not manually enter data into WHONET. They already have some system. It might be very basic, it might be very, very complex, but they want to download and standardize their data. So just to repeat what I just said, most labs in the medium and high resource world already have computer systems. Also many in the low resource world, Vitex and Microscans, Excels or Access or other local systems, as I mentioned in the lower part of the slide. This is a challenge. These systems are not compatible with each other. Different languages, operating systems, hardware, Macintosh, Unix, Windows, data structures, languages, French, Spanish, Chinese, and degrees of sophistication. So that's a challenge, but it's an opportunity. Somebody took the time and effort to get the data into a computer. So if we can find a way to get the data out, then this is the basis of an excellent strategy for data management in real time to support local, national, and global surveillance. So that's the purpose of backlink, to transform diverse data extracts into a compatible system. So backlink is to convert the data into WHONET for analysis. The steps are the step that, instead of talking about backlink, the first step is people don't have trouble with backlink once we help them or they go through the tutorials. The first step is, where did the data come from? So step one is to get the data out of your system. And then configure backlink. You just do that once. Use backlink to convert the data once a year, once a month, once a day. My hospital, it's once a day. Automatically, it's all scheduled. And then step four, getting started with WHONET. Also, we don't teach WHONET. We teach WHONET to everybody: lab, microbiology, pharmacy, epidemiologists. We usually only teach backlink to the 1 or 2 people responsible for managing the data. And automation, that's what we do in my hospital. So I'm only going to talk about step one here. If you have Excel or Access, you already have a data file, and we can help you, and the tutorials can help you. If you have a lab instrument, such as a Vitek, Microscan, or Phoenix, there are simple steps for exporting and converting the data. We have tutorials. The vendors, bioMérieux, Becton Dickinson, Siemens, they've all been very happy to provide support for exporting data from their systems. No need for the local IT department. For the lab information systems, whether it's commercial or it's locally developed, national or international, we usually need help from the IT department. You need to ask the IT department, please give me a data file. And they'll ask you what should be in the file. And you give them a list, and WHONET has a list for you in the backlink tutorial. Patient name, ID, date of birth. You come up with the list. You might have more things or fewer things. It's up to you. It depends on what's in your system. For some IT systems, this is extremely easy. They'll give you the file that afternoon. Other file lab systems, they need a week or two. Other places, it'll take a while because if the feature's not there, they need to talk to the vendor. So that's the first part, is getting the data. Once you have the file, we can help you with backlink. There's a tiny, I'm going to go to backlink just to show you how extremely easy it is to import Vitek. So I have a Vitek file called Vitek demo. This is what a Vitek file looks like. It looks messy, but it isn't. If I open this in Excel, it would look nice. I see the organism name, 5 North, blood, etc. So that's what it, when you go to the Vitek and export the data, that's what it looks like. In WHONET, I'm just going to go through this quickly just to give you a little idea. I'm going to go to New Format, WHO, Vitek Demo, Vitek File Structure. I'm going to choose from this long list of possible imports. I'm going to choose Vitek 2. OK, save, Vitek Demo, exit. That is it. That was the configuration for backlink. I can choose my Vitek demo. I'll call this junk for demo. So that's, now I want to convert it. And backlink will show me the first 3. That looks okay. Blood becomes blood. Isolate 2 with my antibiotics looks okay. Backlink will show you the first 3, so it kind of looks okay. It will finish. And anything it doesn't understand, it says, what does catheterized urine mean? I chose the wrong one. What does catheterized urine mean? And you say, you call it catheterized urine, but WHONET calls it urine from catheter. So you just do that mapping. You call it sputum sample, WHONET calls it sputum. So you have to do that kind of mapping once. Select language. If I put Chinese, if I put Chinese, everything is now in Chinese. If I put Russian, everything is now in Russian, or Estonian is also there. I'll put it back to English. And I think that's all it. And now I'll open it for questions. So, there's a question here. Could you say something more about using WHONET for quality control? Sure, I'm happy to do that. So I'm going to go back to WHONET. So let's see. Quality control is a broad topic. It's not only quality control strains. There's the whole aspect of continuous quality improvement. I did mention if I put ATCC 25922, WHONET knows that that's a QC, quality control. WHONET knows it's an E. coli. And WHONET also knows the appropriate QC range is 15 to 21. So if I, for example, type 30, that gets the special symbol that the result is out of range. So WHONET does have those QC results. That's one kind of QC check. I'm now going to put Klebsiella pneumonia and ampicillin 30 millimeters. Here you can see low priority alert. Klebsiella susceptible strains are rare. Please check this is not a laboratory error. So this is another strategy for quality. I can also go to analysis. WHONET has a feature. Now I'll do the normal one. Isolate listing and summary. I'm going to do organism specimen by day because it's only 1 month of data. I'm going to include cluster alerts and ISID alerts. So the ISID alerts are very closely connected to quality control. I'm going to say OK. I'm going to say organisms all. The options on the left, selections on the right, data fields, and I can choose my 1 month sample teaching file, and I can begin the analysis. As for a list of all 600 bacteria, I have the list of all 600. ABA, Acinetobacter baumannii. As I go over further to the right, if I go down a bit, you'll see occasional things in red. Red means there's an alert, and I'm going to see the alerts here. So I'm going to click on, I'm going to sort this. So I see here at the top, let's go back to the top. I'm having trouble with my mouse. Let me just do page up. Okay, oops, and there. All right, so here are my medium priority alerts, and here are my high priority alerts, such as Neisseria meningitidis, that's high priority. Other things here is like MRSA is medium priority alert, and here you see quality control. So this particular example, I just need to make this column a bit wider, discordant results. So what this is saying, if I go back and I look at the red, let me go back to the left. So this is a strain that is meslacillin susceptible These are old data. Nobody tests meslicillin any longer. But it's augmentin, intermediate, or resistant. So it doesn't make sense. You should not have an E. coli that's sensitive to ampicillin, but resistant to augmentin. So so you see some of these alerts are quality control, important resistance. And if I'm a national data manager, there's a similar feature here that focuses only on the alerts, but it's a different way of looking at data quality. And if you're a national data manager, you may want to look at important resistance, important species, and quality control as three separate issues for discussion. As long as I'm here, this is a nice feature I like showing. WHONET does have the ability to look for possible outbreaks. Here we have many diphtheroids on the same day. Many diphtheroids on the same day is probably more of a contamination than a true outbreak. Even in a true outbreak, it's rare. Everybody gets sick and diagnosed on the same day. Whereas Klebsiella, this is more of what a real outbreak would look like, 2 and then 3 and then 5 people. So ICID alerts has to do with quality control and important resistance and important species. Cluster alerts has to do with possible outbreaks. Okay. Other questions? My passion is on the analysis side, so I got to squeeze a little bit of that in. Another nice feature in analysis is macros. If you're doing the same analysis every week, I can just go to percent RAS, Staph aureus, and E. coli, and Klebsiella, okay, data files. And if I say this is a macro, and I just say, RAS, save, exit. If I come back a week later and I go back to macros, I can simply load that, and then it just remembers everything. So it's a very convenient way to do repetitive analyses. There's another feature called quick analysis, which allows you to bundle them together, and then you can report directly to Excel. So if you're doing the same analysis every week or every month, WHONET has a number of features to help facilitate that. That is the end of the hour. Are there other questions?
There doesn't seem to be any more questions. So with that, I would just like to say thank you so much. We had quite a lot of participants today, so thank you for joining. Thank you very much to John for getting up at 5 o'clock in the morning to deliver this session. And would like to close by reminding you of the upcoming sessions of 2018, which will be one on diagnostic stewardship and one on data analysis and interpretation. So we'll be back to you soon with invitations on those. And if you have any further questions, feel free to email us at the email address given in the beginning. Or for specific questions on WHONET, of course, you can reach out to John as well. Thank you very much and have a good day. Bye-bye.
Thanks, everyone. Bye-bye.